Our fourth panelist is Joyce Sullivan, a certified health educator with Shanti OC. Joyce delivers age-appropriate and medically accurate sexual health education that complies with the California Health Youth Act. She enjoys keeping up with the current lingo so she can engage young people in meaningful dialogue and their developing bodies and help them make healthy decisions around sex, consent, relationships, drug and alcohol use. Joyce also facilitates discussions at senior centers where she helps seniors explore dating in the golden years and intimacy after the loss of a spouse. Joyce has been a lifelong activist with the HIV community in Laguna Beach.
Good morning. It's a privilege to be with all of you this morning. I want to start out with a disclaimer. The lens in which I am presenting sexual health and services for seniors. I am a 66-year-old woman. I identify as she. I am a mother of 4 and a grandmother of 6, a person of color living in South Orange County. I do not represent all of women's experience throughout the country, and I do not want to claim that I represent that. The opportunity that I have to do sexual health in high schools throughout Orange County that are California Healthy Youth Act compliant, as well as facilitating discussion groups in Orange County, is a great privilege. And it does not qualify me to speak about all women's experiences. The phraseology even around senior health and senior health education. What do we even call our seniors in America? We call them the aged, the old, the elderly. Now, with COVID-19, we are the extremely vulnerable. I also want to claim that we are women of wisdom, capable of hearts. We are adventurous, we're curious, we're friends, we're lovers, we're mobile, we're fully alive and able. Women of a certain age are not sitting around the house in their house dresses, making Jell-O and Jell-O molds. We may be sitting at home in our PJs and sweats due to the pandemic and sheltering at home, but yet we are contributing members of society. I am blessed to be the health educator of Shanti Orange County. We go out and do education in high schools. Shanti is a nonprofit organization that provides mental health services, individual counseling for anxiety, depression, addiction, and anxiety. We also provide HIV care, case management. We refer to wonderful people like Michelle Sherman. We provide support groups as well as community education. All of that is now done through telehealth, and we are very grateful that we have a great retention rate. What I want to share with you today is that senior age women have the same enthusiasm, curiosity, trepidation, and awkwardness about sensuality and sexuality as the freshmen in high school. When I have the opportunity to discuss in the groups at senior centers about sex and sexual health, this is often the first time that women have been able to talk about their desires, their concerns, and ask questions aloud without judgment and stigma. When they are at this point in their life, when they perhaps are looking for a new partner and asking questions about safe sex practices, this is not something that they have had language about, or that they've been even encouraged to have the discussion with their peers, let alone their family members or their healthcare providers. It has been a delight to facilitate these groups because people really are longing to have that candid discussion. We have encouraged people to explore what they are looking for in relationship and to talk about consent, to talk about safer sex practices. We encourage them to go get a sexual health screening. It is often a very uncomfortable and awkward discussion for many of them, and they're squirming around in their chairs, but then you see a light come on and their eyes are wide open and they want more. I was originally scheduled to have a 6-week discussion series in Huntington Beach. And after the 6-week series, they asked for more. And now this has turned into a 6-month program that was cut short due to COVID-19. Many of the women that I spend time with and are in the discussion group have been in long-term relationships. And due to either the death of a spouse or partner, a divorce, a termination of a relationship, or a change in healthcare condition, they find themselves single again. Currently in the US and other developed nations, there is a 60% reporting of the population feeling lonely. Many seniors feel left out, they feel poorly understood, and lack companionship. As we all know, loneliness and being isolated has an impact on our overall health. Many people live with a partner, but still feel alone. In the few months that the situation has changed everything, loneliness has now been exacerbated. People are sheltering in place and being physically distanced by the CDC guidelines to protect the very frail, to protect those who are at the greatest risk of dying from COVID. Enforced social isolation is rare in non-incarcerated population. And during this time of heightened anxiety, financial insecurity, and the outrage at injustice, we are being advised to keep our distance from one another. The senior population is not only being hit harder by the virus, but seniors are now isolated from their loved ones, as their family members are fearful of transmitting the virus to them. Social interactions are almost non-existent. Senior centers are closed. It was once the hub for community and social gatherings, dances, classes, discussion groups, and workout centers. I have deep concern about the impact that this has on our senior population, me included. According to the Journal of Psychiatry, social isolation is damaging to our health and can have the same impact as smoking 15 cigarettes a day. There's been numerous studies that have shown that when people can rely and share their life experience with someone who knows them intimately, it can help their nervous system relax. It helps their brain stay healthy and reduces emotional pain. For the last 2.5 months, I've had the opportunity to be an essential worker in an assisted living community in Anaheim. I am a care manager for an 86-year-old woman who had a bilateral pelvic fracture. Everyone in her senior community is isolated into their own apartment. The staff, of course, has been very caring and considerate and are doing the very best they can. Their dining rooms are closed and all of their meals are delivered in a plastic box on a cart. They eat alone in their apartment. They need to wear masks when they go and get their mail in the hallway. The staff wears masks and gloves. All of the furniture that was out on the patio where they used to congregate has been moved. There is now a central courtyard where people can gather, and the tables and chairs are placed 6 feet apart from one another. Many seniors have the additional challenge of being sight impaired and having trouble hearing. They don't recognize their neighbors. And their beauty parlors are closed, so their hair is longer. And many of the women who have chosen to dye their hair now have inches of gray at their roots and are too embarrassed to be seen in public. I have good news to report as well, that most seniors are extremely resilient. They have survived so much already. They were children of the Depression. They may have lost a spouse and even a child, and many of them their closest friends. For some, their independence. Yet they are still longing for connection. The community that I work at has set up a pen pal program where people can write notes to each other that the staff delivers, because they are not to visit each other in their respective apartments. For the seniors who live in their own home and we're starting to explore the possibilities of dating, perhaps on the internet or with those that they have met in the community, they have big decisions to make. If they've met a new partner, now do they need to stay socially isolated? 2 of the discussion group participants started dating, they fell in love, and COVID hit. They needed to decide, would they need to be socially distanced from one another? They had a deep and meaningful conversation, and now they have decided to shelter in place together. One of the women who was just starting to date said that now she feels like she is being treated like a leper. We opened today's Women's Summit with, can COVID-19 be a transmitter in sexual relationships? And people who are within 6 feet of each other, perhaps being physically intimate, they are at greater risk if they are going to share droplets. So the very act of intimacy, one more time, puts people at risk, and especially seniors. So there's a unique challenge for dating for seniors. Many of them have never tried the internet. And we can look now that with all of the senior communities being closed, where are people connecting? Shanti Orange County is doing its best with telecommunication appointments. I have some of my participants who have made personal calls to me because we encourage people to get sexual health screens before they become intimate with partners. And now, because of COVID-19, many of their physicians are not doing in-person visits. So not only is there some discomfort and awkwardness for seniors around talking about their sexual experiences or desires or activities with their medical providers, it's they no longer have access to their physicians. So for some seniors, they are having clandestine meetings with their lovers. They are now not telling their family members that they are now dating again because they don't want to hear and be judged that they are putting themselves at risk. Because one is in their 60s, 70s, or 80s does not mean that they are not longing for sweet connection and sexual romantic intimacy. It is still happening, but it's happening undercover, even in assisted living communities. All of the communities have cameras in the hallways so they can see the movement of their residents. All of that interaction is now discouraged, and there is some reprimand that these seniors are now experiencing. COVID-19 has certainly changed the landscape for seniors. Many of them have been social activists their entire life. They see what is happening on the television. They know what is happening in their communities. Without COVID, they would be out there marching, protesting, having their voices heard. They're afraid, they're anxious, yet they're fully alive and want to be included in the conversation and haven't quite figured out how. Unfortunately, as you can see, I don't have a lot of slides because I'm not very techno savvy, and we've had some health challenges in my own family this week. So I've chosen not to participate in the slide presentation. So seniors who have challenges with technology are now no longer able to connect with family members. They are uncomfortable with telehealth. They've not had that experience before, let alone when it comes to their sexual health. They have that further stigma. When I go into freshman classes and I talk to them about consent, about safe sex practices, about honoring your body, about mutually pleasurable sexual experience, I tell them that these are necessary conversations and we can have them out loud. And then I share with them that I have these very same conversations in senior centers. And I get a lot of groans and eye rolling because young people don't even see seniors as sexual beings. Seniors have a hard time giving themselves permission to be open about their sexual desires and their sexual activity. I'm very grateful that the Women's Health Summit has put senior sexual health as part of its panel discussion. It's an important component, and to have it voiced, to have it said aloud, that yes, seniors are vibrant, they're alive, they have needs, they might have some challenges around technology, but if they are patiently taught, we too can step up. We too can learn new ways. I was very new to this whole Zoom and virtual learning and virtual presentation. And when this opportunity was presented, I was honored to be able to be a part of it. I received a phone call just a few weeks ago from a woman who wants to put herself out there in the internet dating site. She asked, I don't know how to write a profile. She is a cancer survivor. She has had a mastectomy. She asked me, how do I move forward? I don't want to be rejected because of my health condition, but I feel it's only fair to warn any potential partner. Do I tell them that I've had a mastectomy? So we had a very sweet and candid conversation. And I simply made a suggestion that she could say that she was a breast cancer survivor so that she could put that out there. So discussion is still happening on a much smaller scale, but it's still effective, it's still meaningful, it's still necessary, it's still alive. I'm most grateful to be a part of this summit and to be the health educator at Shanti, Orange County. Thank you very much for the time that we have been able to spend together today. Thank you.